Hi guys, happy new year. Welcome to year 2022. Yep, year 2022 finally. Okay guys, I am OOA. Welcome back to my channel. This will be the first video in year 2022 and I'm so glad I am alive to do this. I'm so glad you guys are alive to actually watch this video. Happy new year guys, happy new year, happy new year, happy new year. I welcome everyone to year 2022. I'm so glad we are here together again. Yes, of course. Who am I? I'm a Nigerian medical student. I create videos about medical school, talking about my social life and as well talking about some important topics in ONG. Yes, I'm here for you. So guys, if you're just joined the club, you are welcome. Welcome. Yeah, a special guest on my channel today. You're welcome. Don't forget to click on the red button and subscribe to my YouTube channel, and don't forget to click on the bell to get notifications whenever I upload new videos. Okay, so what's popping today? Yeah, I am here for my ONG guys again. Yes, I don't know why I've been uploading videos because of you guys. I guess you guys are special. So we are finally resuming school this week, and truth be told, I'm not ready to resume. I don't feel we should resume this early. I feel we should resume on the 8th or 7th, but not on the 4th. But anyway, all is well. So yes, so today guys, I'll be sharing some tips, like telling you about important topics you need to know in ONG. So my guys that are rotating through ONG will be starting their block lectures this week, and it's a lot of topics, like 7 topics in a day, like every single day. Very stressful. So, and I feel those topics are so many. You just have to know everything, like from A to Z. You have to know everything, but there are some topics you have to know such that if you don't know it, it's a very big offense. Yes, if you don't know these topics, it's a very big offense. So I'm here to save you guys. I'm here to tell you important topics you need to know in ONG. You guys should sit back, relax, and enjoy this discussion with me. Guys, welcome back. So as I have been saying, and as I will always say, ONG is an interesting posting. Please don't have a bad mindset about the posting. Some people are already saying ONG, let's say it's go sure, but I doubt if I will enjoy it. But truth be told, you will enjoy it. So you guys should just relax, don't be scared. It's go fine. So as I said earlier on, there are so many topics you need to know in ONG, like all the topics you'll be doing in your block lectures from A to Z. But there are some important topics you just need to know, such that if you don't know it, it's a very big offense. The very first topic you need to know in ONG is normal labor. Like, you just have to know everything about labor, talking about the definition, talking about the stages of labor, talking about how each stages goes. Like, you just have to know everything about labor. If you don't know it, it's a very big offense in ONG. Like, if you don't know labor, what else do you need to know? And please take note of this: for every definition you give in ONG, it must be functional and precise. Like, they kept on saying it. Like, I remember when I was going through ONG, like, if we are told to define something, the very first thing they say is, please remember, let it be functional and precise. So you have to make all your definitions functional and precise. So you guys should take note of that. Normal labor is the very first topic you need to know in ONG. Very first important topic you need to know. Number 2, the second important topic you need to know is pre-eclampsia. You just have to know that one. Like, you must know hypertension in pregnancy. You just have to know it. If you don't know it, what else are you going to read? Like, most of the cases you meet on the ward are are actually pre-eclampsia cases, and so you must know how to clear such case. You must know how to give diagnosis of pre-eclampsia. You must also talk about the signs and symptoms. You must know about the risk factors of pre-eclampsia, and of course you have to know about imminent eclampsia. Then you must also know about eclampsia as well. Of all these things I have spoken, one important thing you need to know under the topic of eclampsia and pre-eclampsia is the management. Please, for every topic you read, the management is very, very important. You must know all those regimen in pre-eclampsia, how the drug, marks of, is being administered. You must know the signs of toxicity. Sorry about that. You must know that very well. So don't forget normal labor and pre-eclampsia. Number 3, the third topic you need to know in ONG is malaria in pregnancy. You see, something about ONG is that you must know all the medical cases in ONG, and by that I mean hypertension in pregnancy, malaria in pregnancy, sickle cell in pregnancy, anemia in pregnancy. What else? As time goes on, I will remember and say everything. So I said malaria in pregnancy. Yes, you must know the dates of pregnancy at which malaria drugs can be given, and that is from 16 weeks to 36 weeks. That is the period at which you can give malaria drugs. And of course we must actually know the drugs you can give in each trimester. Yes, they differ, and you must know the doses as well. So one thing our HOD told us when he came to class to teach us malaria in pregnancy was VBAC malaria program. You must know that, like, it's very, very important, because they can tell you to write a short note on it, so you must know how to write a short note on that. So don't forget, take note of malaria in pregnancy. Don't forget the test you can do to diagnose malaria in pregnancy, the week at which you can give malaria drugs, and also don't forget the IPT, intermittent preventive therapy, is very, very important. You must also know that, and you must also know the dosage as well. And don't forget the VBAC malaria program. You must be able to write a short note on it, talking about their aims, their goals, their motives, their vision. You must know all that as well. The fourth topic you need to know in ONG, please, even if you don't know anything, antenatal care, you just have to know it. If you don't know it, it's a very, very big offense, especially if you meet Dr. A. I don't want to mention his name, but he loves antenatal care. So if you don't know anything ONG, please make sure you know antenatal care. Under that topic, you have to know the definition. Don't forget functional and precise. Well, when we talk about definition for antenatal care, I will not really say it's functional and precise, because I'm not talking about any anatomy like that. You are just talking about the care that pregnant women get with the aim to attain and maintain a good health of the pregnant woman and the child as well. So you must know the types of antenatal care. You must know the one we practice in our environment. You just have to know it. Then you must know how it runs, like how many weeks interval, and what are the tests we do. The booking parameters is very, very important. You must know it. It can come out anywhere, and it's a very common question in bedside exam, like a very, very common question. They are 9 in number, so you just have to know the booking parameters in antenatal care. You must talk about all these supplements they get. You must know their dosage as well, and you must talk about the special people, when by that I mean those that those that have HIV, those that have sickle cell, and those that must have a splenectomy. Like, there are special set of people, and there are a particular dosage of drug they must get, especially when it comes to IPT. And by IPT I mean intermittent preventive therapy for malaria. So you have to take note of that. It's very, very important. So the fifth topic you must know: obstetric oh god, why am I doing this? Obstetric hemorrhage. Yeah, antepartum hemorrhage and postpartum hemorrhage. You must know that. Like, it's very, very important. You must know the definition. Don't forget functional and precise. You must know the causes of antepartum hemorrhage and postpartum hemorrhage. Very, very important. And also, please don't forget, when you're reading antepartum hemorrhage, you must know the differences between placenta previa and placenta abruptia. It's a very, very common question in ONG. So the next topic you have to know in ONG is anemia in pregnancy. You just have to know that one. Like, very, very important, because they keep asking for values every time. So the values must be in your head. You must not forget it. If not, you're on your own. No. So you just have to know anemia in pregnancy. Also, a very common topic they like in morning review: you have to know ectopic pregnancy. You just have to know it. Like, I can't count the number of times we talked about ectopic pregnancy in morning review. Like, it was as if we kept on talking about it every single week. Like, we were so scared. We actually thought it would come out in our end of posting exam, but I guess we were so lucky it didn't come out in our end of posting theory exam, but I think it came out in our objective. So you must know ectopic pregnancy. You must know the site of an ectopic pregnancy. You must know how to diagnose an ectopic pregnancy too, and you must know the criteria for diagnosing ectopic pregnancy. You must know that very well. You must know the common features seen in a woman with ectopic pregnancy. Like, very, very important. Please don't forget about it at all. So the next topic I feel you should know in ONG. Okay, let me talk about some topics in gynae you need to know. You just need to know abortion. You need to know that one. Like, it must be part of you. So if you are one of those overzealous person that keeps saying, I don't believe in abortion, I can't read anything about abortion, by dear, you just have to read it. Yeah, you have to read about abortion. You must know the definition, of course, as well. Don't forget functional and precise. And also, when defining, please don't forget the weight of the fetus, which must be less than 500 grams. Please take note of that. I think yes, you have to know that one. Then you have to take note of the weeks too. Don't forget, please. Very, very important. Like, very, very important. It's less than 28 weeks in Nigeria, less than 20 weeks in US, less than 24 weeks in the UK, and less than 22 weeks according to the WHO. You have to take note of that. You also need to know the causes, risk factors of abortion. You need to know the types of miscarriage. You need to know how they present. You need to know how to manage these types of miscarriage, the drugs you give to the patients, the antibiotics, the fluid. You need to know all that. And of course, you need to know about unsafe abortion. They kept on disturbing us. It was about the definition of unsafe abortion. Like, they expected us to say a particular word. Like, even though you say it in your definition, they expect you to put it in a particular way, which I am still learning myself. You just have to keep learning. So don't forget to talk about the complications. You just have to know about the complications of unsafe abortion and the components of the healthcare services. There are 5 in number. You have to know that, and you must be able to explain every one of it. So another topic you need to know is cervical cancer. You just have to know it. Like, it's a very we actually talked about it a lot lot. With the time I was going through ONG, we talked about it a lot. So you just have to know cervical cancer. You need to know the staging. After that, you need to know endometrial cancer. Then you also need to know what's this topic again? There's another cancer you need to know. As time goes on, I'll remember. Okay, after endometrial cancer, you need to know, okay, cancer of the vulva. Yes, you need to know that one as well. Then you also need to know PID. You need to know PID, like it's very, very important. You just need to know PID. So you just take note of all those topics. So apart from that, you need to know family planning as well. You just have to know it. Like a lot of us could not even read our materials on family planning until about few days to exam, including me. Yes, like it was just too much to read. So you need to know about family planning. You need to know the methods. Then you need to know what each method contains, talk about the side effects, and please take note of this. If they tell you to write about a method in exam, please don't forget to write about the advantages and disadvantages and the side effects. Very, very important. Please don't forget that one. It's very, very important. So what else do you need to know? Don't forget to take note of all definitions in ONG. You will see that in the first 2 pages of our synopsis, they actually defined different definitions in ONG. So you just need to know every one of them. Not everyone though, because I did not even read every one of them, just the important and common ones that they do ask. So you just have to know it. Then also another topic I forgot to mention, breech presentation. You have to know that one, because they will ask you questions when you are in the theater. They'll be like, what's this layer of the baby? Apart from that, say when you are examining the abdomen of the pregnant woman, you have to be able to determine the lie of the fetus. So you have to know if it is a breech presentation or an abnormal lie. You just have to know that. So you have to go through that topic, and you must be able to know all the maneuvers of delivery of a breech fetus. So you have to know that one. So another topic you must not forget is cesarean section and VBAC. That one is very important. You just have to know it. Yeah, they actually asked us question on VBAC in our end of posting exam, and if you don't know it, it's just as if you don't know anything. So you must know cesarean section and vaginal birth after cesarean section. You must know the indications for cesarean section. You must know the classification of CS, the definition. You must know how CS is done. You must know the layers cut through when CS is being done. You must know it. Then also you must know, okay, I don't know about some people, but when I was going through ONG, the SR I was on call with, one of the days when I was on call, and talked about knowing the type of sutures. I don't know for that SRs, but I think it's important to know it. So you have to know the type of sutures that are used in the classifications. You have to take note of that as well. Then also don't forget VBAC. You must know the indications for VBAC. You must know the contra indications for VBAC. You have to know that one. They actually asked us in our end of posting exam, and just have to know it. So I guess with that, I've been able to say a lot. I think I've mentioned a lot of topics in ONG that I feel you should know. Yes, I won't forget this topic, obstetric fistula too. You need to know it. Okay, just as if I'm mentioning all the topics, but please take note of these topics I'm talking about. You need to know obstetric fistula, because it's a common case you will see in Elisha, and it's not be nice if they are repairing a fistula and they ask you a question. So you just have to know it. You need to know it, because if you should meet the consultant in that area, yeah, the high risk of being asked that question, so you just need to know it. So don't forget obstetric fistula. Then after all those topics, I feel you can now go back to other topics, yeah, and just go through them. So with this, I believe I've been able to talk about 1 or 2 things about important topics in ONG. And also, I forgot to mention, you have to know diabetes in pregnancy. You just have to know GDM. You need to know it. I remember one of my calls I was on, like, I just presented by 6 p.m. I had not done anything. I just entered the ward just for me to say hello to the SR, and immediately I got in, was like, define GDM. I was like, sir, calm down. He told me to define it. He told me to talk about the indications for EDM, sorry, the risk factors for GDM. He told me to talk about it. I was kind of nervous though, but thank God I was able to say something. So you need to know diabetes in pregnancy is very, very important. So I think with this I've been able to talk about the important topics you need to know in ONG. So you guys, till next time guys, in case you have any questions, you can always put it in the comment section, or you can always enter my so till next time guys, don't forget to subscribe and click on the bell to get notifications whenever I upload new videos, and of course share this with your friends in medical school. I feel this will be very, very helpful. So guys, till next time, bye and happy new year.